Hi there, this is Gabe with Design Team 1, and today I'll be talking about minimizing external exposure of nasogastric tubes in pediatric patients to prevent accidental removal. A nasogastric, or NG tube, is a thin, flexible plastic tube that passes from the nose through the esophagus into the stomach to deliver or remove contents. NG tubes are used for patients with swallowing difficulties, malnutrition, inflammatory bowel disease, head and neck cancers, and related conditions. When not in use, NG tubes are typically secured with tape, tucked behind the ear, or held in place with a nasal bridle. Children often pull these tubes out of curiosity or frustration, which frequently dislodges or removes them. This leads to repeated NG tube replacements, which are time-consuming, costly, and potentially traumatic for young patients. The need for a more reliable method of limiting patient interaction with and securing NG tubes in place has already been expressed by pediatricians across multiple hospitals, such as Children's Hospital of Philadelphia, UPMC's Children's Hospital, and others. Our solution aims to minimize the external component of the NG tube in an effort to limit exposure. We adopted an out-of-sight, out-of-mind mentality to prevent children from interacting with components that are visible to them. In our prototype, the external portion of the NG tube can be detached from the rest of the device, which eliminates the need to tape the external tubing to the child's face. When needed, parents can simply reattach the tube via the Lorlock system, one that many nurses are already familiar with, to ensure the secure attachment of the internal tube and prevent it from falling back into the nasal cavity or esophagus. Our design team designed a nose clip that is connected via the Lorlock and will anchor the tube to the side of the patient's nose. Our first prototype used Lorlock models from McMaster-Carr, but these parts were bulkier than needed and not intended for medical use. To reduce the nostril component's diameter, our second iteration uses a slimmer Lorlock mechanism commonly found in IV connections. In our initial low-resolution prototype, we designed a silicone nostril clip with a central aluminum strip for molding to the nose, a magnetic component to hold it in place, and an inner Lorlock pocket to secure the NG tube when not in use. However, the design was too complex to scale to pediatric size, and our clinical mentor advised against using magnets due to safety concerns. This represents our revised model for securing the NG tube to the nostril. A simpler nostril clip integrated into the Lorlock mechanism will anchor the tube. It can be used with bridled NG tubes, and we aim to make it adaptable for unbridled tubes as well. After building the prototype, we will conduct VMV testing on a mannequin to identify the optimal NG tube size that avoids airway blockage, verify that the Lorlock securely connects both components, and ensure the nose clip prevents retraction into the nasal cavity. Based on our mentor's guidance, we will conduct IRB testing on adults for proof of concept. Dr. Stebris confirmed that this is more feasible and safer than pediatric testing given the short timeline and higher risks. These tests will assess device security and overall functionality. Thanks for listening.